Yeah, so cognitive behavior therapy for BDD is the main psychotherapy treatment. And I think of it as having basically four components. And one is exposure and response prevention, pretty similar to ERP for OCD. And the second is cognitive therapy. The third is a focus on how people pay attention, both sort of figuratively as well as literally, the way they look at themselves and the way they look at other people. And then the fourth component is working on motivation. And CBT, a typical manualized course of CBT for BDD, might take about 22 sessions or so. It's highly collaborative. The therapist is an expert in some of the mechanisms about how BDD is maintained and what one can do to break those. And the patient is the expert in their own experience and their own ways of thinking and acting, and you collaborate together to identify the mechanisms and change them. And the other thing about CBT for BDD is that it's pretty present focused. So you don't need to understand necessarily exactly why the symptoms first developed, what originally caused them, in order to be able to address and identify and then change the mechanisms that are perpetuating them in the present. So exposure and response prevention. Exposure is systematically and in a controlled way facing your fears, and it's really the best way that we know, the easiest, most straightforward, and most effective way that we know to help get over any kind of anxiety. You always need to face the thing that causes the anxiety, the situations, etc. Response prevention is refraining from engaging in rituals and avoidance and reassurance seeking before, during, and after you engage in the exposure. It's really important to engage in the response prevention, because if you don't, you never find out what would actually happen, whether your predictions come true, what it's like for you, can you handle it, will it be as big a disaster as you think? And when things don't play out as feared, you chalk it up to the rituals or to the avoidance. It only didn't happen because I was so careful to do my makeup or whatever it is that you're talking about. So you can get this sense over time that you're averting catastrophe by engaging in all these behaviors without ever actually putting it to the test. Cognitive therapy is designed to help you evaluate the ways that you're thinking about things and how those might be perpetuating your body image dissatisfaction. So are you thinking in biased or distorted ways, both about your appearance as well as the importance of your appearance, the contribution of your appearance to your overall self-worth? For example, a lot of people are very perfectionistic, maybe in general or specifically with their perceived flaws in their appearance, and have all sorts of all or nothing kinds of ways of thinking. Cognitive therapy might address that. In addition, with cognitive therapy, we use what we call behavioral experiments, where you systematically test things out. And what happens for many people is that they have these vague predictions that are untested and really hard to know about, say, what other people are thinking of them. So they're very worried that when they go places or do certain things without their rituals or without the reassurance and the avoidance, that other people think they look grotesque or other people are judging them, and they don't really have specific evidence for that. With the behavioral experiments, you learn whether or not, in fact, your fears will come true, and you get a chance to look specifically for specific pieces of evidence and to put them to the test, rather than having sort of a vague, amorphous sense that people will think badly about you, people will think you're gross. How would you know? Are they really telling that to you? You never usually get a chance to actually test very specifically what happens and what it's like for you.